Hi everyone. Today we're going to draw the thoracic limb to the body trunk muscles. And this is a group of 8 muscles, and their primary functions are to advance or protract the limb and draw it back caudally or retract the limb. The other important function some of these muscles have is to support the body trunk between the thoracic limbs. So let's begin again, as we typically do, by drawing our skeleton. So we'll begin with the scapula, and we'll quickly draw the humerus between the greater tubercle and epicondyles. We'll draw the ulna between the lateral stylated process and the olecranon, and we'll finish off the antebrachium with the radius cranial to the ulna. And we'll put in the carpal bones, some metacarpal bones, proximal, middle, distal phalanx. So the first muscle we are going to draw is the serratus ventralis. And this muscle basically spans between the medial aspect of the dorsal scapula, and it spans down, and we'll draw it in a dotted line as it is deep to the scapula in this point. It comes down and inserts on the ribs in various portions. So it forms like this big fan-shaped structure. And also cranially it comes down and actually inserts onto the transverse processes of the cervical vertebrae. So you have this large fan-shaped structure. And the primary function of the serratus ventralis is it supports the body trunk between the thoracic limbs. And the innervation of the serratus ventralis is the long thoracic nerve. So the long thoracic nerve is actually a derivative of the 7th cervical spinal nerve, so it is considered part of the brachial plexus. The next muscle we're going to draw is going to be the rhomboideus. Now the rhomboideus runs from the dorsal aspect of the scapula to the raphe over the spinous processes of the first few thoracic vertebrae and the mid-raphe over the neck and to the head. So we're going to draw a simple line here from the dorsal border of the scapula to these points. Now the innervation of the rhomboideus is primarily some dorsal branches of the cervical and thoracic spinal nerves. So this would represent the rhomboideus. The primary function of the rhomboideus would be to keep the dorsal aspect of the scapula up against the body trunk. The next muscle, well actually a group of muscles we're going to talk about, are those innervated by the accessory nerve. Now the accessory nerve is a little bit unique from these other nerves we're talking about that originate from the brachial plexus. And the accessory nerve is actually a cranial nerve, and it originates and arises from the brain. So the first muscle we're going to consider is the trapezius. Now the trapezius runs from the spine of the scapula up to and over onto the mid-raphe of the neck and some of the spinous processes of the thoracic vertebrae. So this red line would represent 3A, or the trapezius. And the trapezius, again, is innervated by the accessory nerve. The primary function of this muscle in this position is to keep the dorsal aspect of the scapula against the body. Another muscle innervated by the accessory nerve is the omotransversarius. The omotransversarius spans between the acromion, or distal scapula, and the wing of the atlas. So it basically runs in this function here. So this would be the omotransversarius. Now the omotransversarius, again, as I said, innervated by the accessory nerve. The primary function of this muscle is to pull the limb cranially, or limb protraction. The third muscle we'll consider innervated by the accessory nerve is the brachiocephalicus. And we're going to talk predominantly about the cranial part of the brachiocephalicus. So I'm going to change the color of this one a little bit to distinguish from the omotransversarius. And basically this comes from the head and the neck, and it's a compound muscle, and they come together. And there will be basically a distal part of the brachiocephalicus we'll talk about in a minute, but we're going to call this the brachiocephalicus. The brachiocephalicus also has a function in limb protraction, or pulling the limb cranially, and this muscle is, as I said, innervated by the accessory nerve, and it runs from the head and part of the neck down here to the arm. So we'll just continue on with the brachiocephalicus, and we'll change our color. And the distal part of the brachiocephalicus comes down and inserts onto the cranial aspect of the brachium. So we're going to label this as 4A, and that's innervated by the brachiocephalic nerve. Now the brachiocephalic nerve actually originates from the brachial plexus, and it originates from the 6th cervical spinal nerve. But again, 3C here and 4 are all part of the brachiocephalicus, but they're just innervated by different nerves. The distal part, number 4, is innervated by the brachiocephalic nerve. 3C here, the more cranial part that goes to the neck and to the head, that's innervated by the accessory nerve. The next pair of muscles we'll discuss are the pectoral muscles, and we'll begin with the deep pectoral. Now the deep pectoral will span between the proximal medial humerus and come down to the length of the sternum. So that would be the deep pectoral, and we'll label that as 5A. The deep pectoral is innervated by the pectoral nerve, and this is also a nerve that is considered to originate from the brachial plexus anywhere between, it's kind of a complicated combination of nerves from the 6th cervical spinal nerve to the 1st thoracic spinal nerve. Now the function of this muscle is to pull the limb back caudally or retract the limb. The other pectoral we'll consider is the superficial pectoral. Now the superficial pectoral will be up here in front, and it will come from the proximal aspect of the humerus down to the first few sternobrae. So this would be 5B, or the superficial pectoral. This muscle is also innervated by the pectoral nerve, but has a function opposite of the deep pectoral in that it pulls the limb cranially or protracts the limb. Now the final muscle we'll consider in these limb to body muscles is the latissimus dorsi. So the latissimus dorsi is a muscle that spans between the proximal medial humerus, and it comes all the way up here to the thoracolumbar fascia over the back and the lumbar and thoracic vertebrae. So this is that large latissimus dorsi muscle. So this would be 6A. Now this is innervated by the thoracodorsal nerve. So the thoracodorsal nerve also originates from the brachial plexus around the 8th cervical spinal nerve, and you can guess what the function of this muscle is. It's to pull that limb back caudally or retract the limb. So these are the 8 muscles that attach the thoracic limb to the body, organized by innervation.